Let's now proceed to diagnosis according to Sanjal theory with the pattern wind heat invasion in Upper Jiao. Diagnosis according to Sanjal theory was developed by Wu Ju Tong. While he lived, his home region was affected by many epidemics, including measles, scarlet fever, and smallpox. This meant that he focused his energy on the study of infectious diseases and used the four-level diagnostic model as his starting point. Diagnosis, according to Sanjav's theory, was not exactly a new theory, but more another way of utilizing the diagnostic model of the four levels, where the four levels analyzes the progression of disease in relation to their energetic depth and severity of the symptoms. The Sanjav model utilizes a more two-dimensional analysis of the body. In this model, disease is differentiated from where in the body the disease is located and in which jiao the affected organ are located. When exogenous pathogenic qi is in the upper jiao, the wei qi, lung, or pericardium is affected. This is equivalent to the wei, qi, and yin levels respectively in the four-level model. The patterns are seen when exogenous pathogenic qi affects the yang organs and the spleen. This will be similar to the qi level heat in the four levels. The lower jaw patterns are the most serious. In these patterns, the exogenous pathogenic qi has affected the kidneys and the liver. This corresponds to the two blood level patterns in the four levels. When there is an invasion of exogenous pathogenic qi in the upper jaw, it is the lung and pericardium that are affected. The heart is protected by the pericardium and therefore cannot be attacked by exogenous pathogenic qi. An invasion of pathogenic qi in the upper jaw may be relatively superficial, such as when exogenous pathogenic qi disrupts the functioning of wei qi. This will be similar to the wei level in the four-level model. Upper jaw heat can also be deeper than the wei level in the four-level model. Lung heat in the Sanjiao model being similar to qi level heat. If the pathogenic qi invades the pericardium, it is relatively serious condition and will correspond to yin level heat. Pathogenic qi can jump directly from the lung and wei qi aspect to the pericardium and the blood aspect. This is due to the close proximity of these two organs have to each other in the upper jaw. Wind heat invasion in the upper jaw for a description of the symptoms and mechanism this pattern. We referred to the section discussing wind heat in the four levels as these imbalances are virtually identical. This pattern's etiology can be traced to exposure to pathogenic heat. So for the symptoms and signs, there will be acute fever with mild aversion to wind and cold, no or little sweating, throbbing headache, thirst, sore throat, red swollen throat, cough, irritability, restlessness, yellowish or dried mucus in the nose. The forehead may feel warm to touch. The tip of the tongue may be red and there may be a thin yellowish coating on the front, a rapid and superficial pulse. The key symptoms here, fever or feverish sensation and an aversion to cold, superficial, and rapid pulse. For the treatment principle, we expel wind heat and activate the wei qi. We can choose from the acupuncture points do 14, Li4, Li11, lung 7, Li10, Li11, UB12, UB13, and gallbladder 20. For the needle technique, we use draining and cupping is also recommended. For further explanation on the choice of acupuncture points, do 14 activates the wei qi and drains heat. Li4, Li11, lung 7, urinary bladder 12, and UB13 expel wind and heat. Lung 10 and lung 11 drain heat from the lung and throat. GB20 expels wind and drains yang from the head. When there is an invasion of wind heat in the upper jaw, it is best not to eat at all or to only eat live food. The person should drink tea that is cooling and spicy in its dynamics, such as elderflower, chrysanthemum, or mint. An invasion of wind heat in the upper jaw can be caused by there is no previous pattern, but it can in turn result to middle jaw heat, lower jaw heat, and pericardial heat. Thank you for your attention.